In Amudat District, which is home to over 200,000 people, residents often travel long distances to access health facilities. The district has 11 health centers, 9 of which are government-owned, while 2 are privately owned. The Uganda Health Sector Strategic Plan indicates that every sub-county should have at least 1 health center 3, each constituency a health center 4, and a general hospital at the district level. However, like many districts in the country, this one struggles to meet the standards.
The greatest challenge why we still have issues in health service delivery has been on the contradiction between the policies and the actuals.
The health infrastructure is limited, with Amudat Hospital, owned by the Church of Uganda, serving as the district's referral facility.
Majority of health facilities in Amudat District are health center tools. So, of course, what does it mean? It means they have a basic package of health services they provide to the population.
Health Center 2s, which make up the majority of facilities in the district, only provide basic services. District leaders have long called for the upgrade of these facilities in vain.
The government initiative to uplift the Health Center 2s to Health Center 3s has taken a very slow path.
So ideally, we are struggling to upgrade Health Center 2s at least to Health Center 3s in order to expand.
Joseph Laboti Nangole, the district's LC5 chairperson, reveals that only 3 of the district's 11 sub-counties have a health center 3, while some, like Kongorok and Karita sub-counties, lack a health facility.
It has become very difficult for us now at the district level to even think about planning for a health center 2 for this sub-county, because the government policy has now changed. You cannot construct. Those ones are being phased out.
The nearest health facility to Kongorok sub-county is Laro Health Center 3, which is 34 kilometers away, while Amudat Hospital is 54 kilometers away from the sub-county.
We have to move a very long journey to access health facilities. Unfortunately, some critically ill patients pass away during the journey. We are asking government to rescue us.
Trying to ensure that Health Center 3 in Loro, the staffs go for outreaches at least twice in a month to this sub-county so that the people can access services.
David Lomiru, the LC1 chairperson of Kongorok Village, explains that when someone falls critically ill, they rely on motorcycle transport to Moroto District or Amudat Town.
Hiring a motorcycle and rider costs over 150,000 shillings, which many people can't afford. Some people opt for walking, and tragically, many die along the way.
Because there is no way someone can come from Nakonyen, around 40 kilometers from Nakonyen, the last parish, Nakonyen parish, to Loro sub-county to receive treatment. Neither can they move from there to Moroto.
The district also faces a critical shortage of medical staff, with staffing levels at 34%. This means some health centers operate with only 2 health workers.
We have been consistent at 34% for a very long time, meaning that you find some health centers with only 2 staffs, 2 health workers.
This was made worse when the Ministry of Public Service halted recruitment. And even where we had wage, we could not recruit because there was a halt as government was doing a human resource audit.
Grace Apio, an enrolled midwife at Laro Health Center 3, describes her overwhelming workload.
Some staffs are working for 24 hours for the last 2 weeks, and it's tiresome, it breaks. So it is one of the biggest challenges we face here, the staffing level. Because if you're having 2 midwives in the maternity setting and one has gone for her annual leave, that means the one remaining will break down. She has to work for 24 hours. We are having 1 clinician and a nurse. If the clinician is off, that means the nurse has to work throughout 24 hours.
Staff accommodation is another problem. This is a rural place where getting accommodation for rent is a very big problem. So I think we really need support.
The health centers are also crippled by a lack of essential medicines and equipment. Without urgent intervention from the government, the gaps in Amudat District's healthcare provision will only widen, leaving thousands at the mercy of fate.
That is Kenya or Uganda. This is almost the last village.